Welcome back. I'm Connie Carroll, and we are here with one of our great doctors from Hoag. This is Dr. Gennady Kolodenker. Thank you for being here, doctor.
Yeah, hi, good to be here.
Good to see you. Now, your specialty is in podiatry.
Yes.
And of course, we're going to talk today about the foot health, foot and ankle health.
Yes, absolutely. It's really important to keep people going and make sure that there's no foot pain or ankle pain.
Absolutely. And one of the first things you might notice in your foot care or foot health is you might have some fungal toe conditions like that.
Some people do get that. It comes with different age. As you do get older, it is a common thing that occurs. What typically drives it is more sweating in the feet. So the more you can keep the moisture down and keep your feet dry, changing socks throughout the day, not wearing the same shoes every day, even using ultraviolet light type of sanitizers that can be purchased online inside the shoes, that'll really help to decrease the chance of developing fungus. And should it be there, there are treatment options from topical, oral, and laser therapies that are available to different patients. So everybody's treatment varies, and so it just depends on the medical history.
And it's so true. It's just something that happens so commonly. And these seem like very simple steps to prevent this.
It is. It is fairly simple. What's also important to know is it is mostly a cosmetic issue, but it does drive a lot of people to come in and have it treated, even though it never really gets fully inside your body and causes any other internal issues. But it can cause thickening and pain in your toes. Yeah. And
that's the worst. We love to have our health and be ambulatory, and foot pain is something that really can just limit you and isolate you if you just can't get around. How can you minimize foot and ankle pain?
Absolutely. The kind of shoes that you wear make the biggest difference. So most people wear shoes that are either too small or too narrow. The width of the shoe, the toe box, that area between the big toe and the little toe makes such a big difference. So when you go shoe shopping, just look for a wider toe box shoe. Women typically will have a harder time finding shoes that are appropriate. Most women's shoes, unfortunately, are made too narrow because that's just, they tend to look nicer that way. There are several websites that will give you some better options, like Zappos or Nordstrom. You can have drop downs where you could choose wider toe box shoes. Softer width, softer forefoot types of shoes are more comfortable.
Softer forefoot?
The front of the foot where the shoe is made will have a little bit more of a give versus like a rigid hard leather.
That's true.
It'll be a lot more comfortable. And then when you're standing in the shoe, making sure that there's about a thumb's width between the tip of the toe and the end of the shoe is really helpful. That in itself is mostly what you'll need to know. For general walking, I usually will recommend more of a running shoe rather than a walking shoe. It tends to be lighter, have better technology, and they tend to also last longer. They're softer. So running shoes, I find, are more accommodative and helpful versus just a generalized type of walking shoe.
And it's such a challenge for a woman to purchase a shoe when your whole life you've just been trying to find the cute ones.
Yeah.
But how about for the gentlemen in our society? How do they find the great shoe for themselves?
So men actually have an easier time because men's shoes, unless it's a really high-end dress shoe, they're typically made more wide to accommodate the foot. They'll have inserts that come out. You could put something else in instead of it. There are several brands of shoes that will have an insert that comes out. So what I usually will recommend is if you're having any sort of foot pain or you want to prevent it, look for the shoes where the insert comes out and you're going to put something else instead, like an arch support, to give you a little bit more cushioning and comfort. And make sure you try that on in the store before you take it home, just to make sure it fits you well. So bring your insert into the store with you.
That's like a general rule of thumb for any kind of shoe shopping, male or female. I mean, bring the inserts with you and try them because they do take up extra room.
They do. You might need a half size bigger shoe in some instances, but for the most part, you shouldn't have to change too much of the shoe, but there's always exceptions.
And you know, it should be a good idea to give yourself a little time to shop, because we have a lot of self-serve shoe shopping experiences now. It's not the way it used to be, where you could just have someone bring you shoe after shoe. It's just not like that.
No, yeah, you have to look around yourself and see what fits you well. So you have to be somewhat familiar with what the better shoe is, and so it's best to always educate yourself about what it is you're looking for in a shoe.
That's terrific. And that minimizing foot pain is so important as well as looking after your tendon and ligaments, because they can get strains and they can be injured. So tell me a little bit about that.
So preventing things like ligament injuries or tendon injuries, I find the main thing is maintaining flexibility. So as long as you're stretching, as long as you're doing things that are actively keeping you going, you can really minimize those types of pains. But really, the flexibility is number one. Stretching your calf muscles, your Achilles tendon, stretching out your plantar fascia, that's the bottom ligament on your foot, really will help minimize those types of pains. And those are the most typical things I tend to see. If you start to feel those symptoms come on, it's important to recognize them quickly, and then that way we can treat them with more ease.
What are those symptoms?
Usually people will have pain in the back of the heel or the bottom of the heel, their arch. When they first get up out of bed, things feel stiff, and then they warm up. During a long walk or run, they will also feel types of sharp aching pains in the areas of the heel or the middle of the foot. Those are typically related to types of ligament or tendon injuries.
And so simple stretching and taking the time to know you need to care for your legs and feet.
Absolutely, and the most important time to stretch is after your activity. Most people tend to do stretching before, but when you're all warmed up, that is the most beneficial time to get a stretch going.
And after an activity, of course, your muscles are warmed up and you're ready to do a good stretch. Can that also happen if you're using a spa bath or anything like that? Any other kind of hydrotherapy or something that's warming?
Absolutely. So warm therapy will relax the muscles and help with stretching, absolutely. Make sure if you do have an injury and you're looking to stretch, you do something warm, do your stretch, and then follow it up by cold. That way you minimize any sort of inflammation. So icing is a great way, a good natural anti-inflammatory.
That's true, got to have that. And it is also good to take care to stretch in the most careful way, possibly seated stretching.
Seated stretching, if you take a frozen water bottle, for instance, and you put it on the ground and you roll your foot on it, that's a good way to stretch the bottom of the foot. The most important thing when doing that is you want to point your toes, focus on pointing them up in the air toward your head while you're doing that stretch to really isolate that plantar fascia. Otherwise, you end up massaging more of the deeper muscles. So that's probably the easiest one to stretch. Just focus, point your toes in the air, and just kind of roll that foot over that frozen bottle.
And just think about it. Seated stretching is something you can do when you're reading, when you're enjoying a show. So you could make sure that you learn some of those stretches and employ them every day, and that'll really help with minimizing any of these injuries or strains. Now, past injury and strain, you could get a fracture, hairline fracture, or even more serious than that. Tell us about what happens after you experience a fracture.
So some people will get things like stress fractures that will develop, and those things sort of come out of nowhere. You could be doing your daily activities and then all of a sudden your foot starts to hurt more. You will sometimes see swelling, but not always. So it's important whenever you see something new to really get in and get it looked at sooner rather than later. A stress fracture is easier to deal with, so we usually take an x-ray to see. Sometimes it can take 3 to 4 weeks to show up on an x-ray.
3 to 4 weeks.
But at that point, what we'll do is we'll change activities, we'll give recommendations, and this will help prevent a full-on fracture.
That's wonderful.
Yeah.
I know that I have a friend who had felt a stress fracture and just said, you know, if I see the doctor, all he's going to do is he's just going to bind it up anyway. But that's not necessarily the truth. You need to keep an eye on everything about this.
You do, because a stress fracture, if it develops into a full fracture, then you could have more of a complication. And if you're ignoring it, you can develop things like non-union, where the bone just doesn't heal up, and then you could be stuck with long-lasting pain. So that's something that we don't want. And if we can guide the patient in a better direction and help prevent any of those long-term symptoms, that's really going to be helpful.
Well, doctor, I'm so glad that you've been here today. Now, how can we reach you at Hoag?
We are located in the Sand Canyon building in Irvine. It's on the corner of Sand Canyon and Alton.
Okay.
There is a transportation system that's available age well from Laguna Hills here to our facility.
Terrific.
And I think it's $4 round trip. We have a website, ocpodiatry.com, and then you could always reach us by phone, 949-651-1202.
And it is a great thing to have that transportation system, age well, that leaves right here from this community.
It's door to door.
It's door to door, and it's only $4. You can save your feet.
Exactly, absolutely.
Doctor, thank you so much for being here
me.
with us. And we love hearing more about this type of health. It's so important to us.
Thank you.
And thank you for joining us.